Okay.
Okay, you can start.
Okay. Hello.
Hello.
Hi. I'm Dr. Mahmoud. I'm one of the doctors in the clinic today. May I just confirm your name and age, please?
Yes, I'm Mrs. Mona and I'm 45 years old.
Okay. Thank you so much for coming to see me today. I have been asked to see you by your GB because of concern of high blood pressure. Is that okay with you?
Yes, doctor.
Okay. So before I start in my discussion, would you please tell me more about your blood pressure?
Yes, doctor. Actually, I have been diagnosed with this high blood pressure for 2 years now. And since then, I have been like given many types of medication, and every time they will try different doses, but
Mhm.
nothing helps.
All right, okay. And may I know what medication are you taking so far?
Yes, last medication prescribed by the GB, olmesartan, for,
Mm,
40 milligrams,
mm.
amlodipine, 10 milligrams, thiazide, 25 milligrams.
All right, okay. And just to check with you, are you taking your medication regularly?
Yes,
Okay. And do you check your blood pressure at home as well?
yes, doctor.
And was it high at home as well?
Yes,
Do you think like you have any fears or anxiety when you see doctors?
not at all.
Okay, perfect. And apart from this high blood pressure, do you have any other medical condition I should be aware of?
No,
Okay. And along with this high blood pressure, do you have any like headaches?
yes.
Okay. And any like where is this headache exactly?
At the front part of my head, behind my
Okay.
eyes.
Okay. And is this headache increased by coughing, sneezing, or leaning forward?
Sometimes, yes, it can increase with coughing and sneezing.
Okay. And is it more in the morning time?
No.
Okay. All right. And do you have any problem with your vision at all?
Yes, I have several attacks of blaring of my vision.
Okay. Which side of your vision is blurred?
Yes, both eyes.
Both eyes. And is it more at the corner of your vision or in the center of your vision?
The center of my vision.
Center of your vision. Okay. And any change in the eye color at all?
No,
And which like do you think like there is problem with the vision color?
no,
Okay. And any weight changes?
no.
Okay. And any muscle pain or muscle cramps?
Yes, doctor. Actually, I'm feeling weak and fatigue all the time.
Mm, mm, mm. Okay. And what about pain in the muscle?
No,
Okay.
no
All
pain.
right. Okay. All right. And any dizziness from standing?
No,
Okay. Any breathing difficulties?
no,
Any chest pain?
no,
Any raising heartbeat?
no.
Okay. Have you noted any change in your water work?
My water work is the same.
Okay. You are not passing any blood or any frothy urine?
No,
Okay. Has there been any skin changes at all?
no,
Okay. And any back pain?
no,
Any joint pain?
no,
Okay. Has anyone commented that you look pale than normal?
no.
Okay. And any change in your bowel works?
My bowel is okay.
Okay. And so you said you have high blood pressure and you are on three medication for that. Anything else apart from high blood pressure?
No,
Okay. And are you taking any other medication at all?
no,
Any over-the-counter medication?
no.
Like something called Lycris. Do you take that at all?
Yes, doctor. I sometimes drink this type of tea. It's a
Mm.
herbal.
Okay. And for how long you've been drinking this?
It is occasionally, doctor, since long time.
All right. Okay. And okay. And if there is any family history of any similar condition or any thing runs in the family?
Yes, doctor. Actually, my father was diabetic and has high blood pressure as well.
Okay. All right. And any problems like kidney problems run in the family?
No.
Okay, fine. And just couple of more questions about your social life and your personal life as well. Are you married at all?
Yes, doctor, I'm married.
Okay. Do you have any kids?
Yes, I have one kid. He's 10 years.
Okay. And any history of miscarriage in the past?
No,
Are you taking any contraceptive pills?
no,
Okay. And was your pregnancy all right?
yes,
Okay. And what do you do for living?
yes, I'm a teacher.
Okay. And how these symptoms are affecting your life?
Yes, doctor. Actually, if my blood pressure is high, I can't concentrate. I feel dizzy sometimes, and
Yeah.
the headaches sometimes become severe.
Yeah, I can see this is quite affecting you, and I will try our best to help you today. And do you smoke?
Yes,
Okay. How many cigarettes and for how long?
yes, I'm smoking about maybe half a pack every day for the last
Mm.
maybe 10 years.
Okay. And did you ever thought about quitting smoking?
Yes,
Okay. Have you tried before?
no,
Okay. Do you want to try?
yes,
Okay, certainly we can help you with that. I will refer you to the smoking cessation clinic. They will be able to sort that out for you. Is that okay?
yes.
Any alcohol drinking at all?
Occasionally, maybe drink a couple of drinks every weekend.
So is it within the recommended units, like 14 units per
Yes,
week?
yes.
Okay. Any change in your mood at all?
Yes, I'm a little bit anxious about this uncontrolled blood pressure.
Okay. And just like I just want to ask you, like, is this headache like comes in attacks at all? Or it is
Uh, yes, the headaches is coming in attacks. Yes.
and at that attacks, do you feel like you are anxious and you have fears?
No.
No, okay. And okay, and any all right, fine. So just to recap with you, that you have got this headache which has been going on for like couple of months, and you've been on three medication for high blood pressure, and that is not helping to bring your blood pressure down. And you
Yes.
also have got muscle pain and muscle weakness as well, and you've got blurred vision, and you have got family history of high blood pressure as well and diabetes. Is there is anything else you would like to add?
No, doctor.
Okay, so may I examine you now?
Yes, please.
All right. So, first of all, I would like to start my examination by checking the blood pressure in both arm, and then I would like to feel before the blood pressure. I would like to feel the pulse, looking for regularity, synchronicity, and any special character. And then after that, the blood pressure in both arms. After that, I would like to do the proximal myopathy. And then I will examine the eyes, looking for any like pallor or jaundice. After that, I will look for the GVB for any rise GVB, and also examining the lower limbs for any lower limb edema.
Yes.
After that,
As
I would
regard,
like to do.
yes, yes.
Mhm.
As regard your part one of your examination, the vitals and the general examination, okay,
Mm,
the pulse is equal on both sides, no special character. The blood pressure is equal on both sides, okay.
mm,
As regard the eye, there is no pallor, no jaundice, no raised GVB. The tongue
mhm.
is okay. The lower limb is dry. What else?
Okay. Okay, fine. After that, I would like to do the cranial nerve examination. So I would like to check the visual field, visual acuity, fundoscopy, and also the pupil reflexes, and
Yes.
also H-shaped movement. And also, I would like to examine for the sensation and cranial nerve number seven, facial nerve.
Okay, doctor. Okay, as regard your eye examination, H-shaped movement is normal. Okay,
Mm-hmm.
field is okay. As regard fundus, later on, doctor. Later on, cranial nerve 712 normal.
Okay, fine. Then I would like to do a cardiovascular examination. I would like to listen to S1 and S2, and also any murmurs.
Okay, S1 is 2 normal, intact,
Mm,
no
mhm.
murmurs.
Okay, and then I would like to listen to the base of the lung, looking for any crepitation.
Base of the lung free.
Okay, then I would like to examine the abdomen to hear for any like for renal artery fluid.
Okay, fair enough.
Mm-hmm.
No per week could be appreciated. What else?
Okay. Okay. And then just I would like to examine for polycystic kidney, see if there is any palpable kidneys.
Okay, fair enough. No palpable
Mhm.
kidneys.
Okay. Thank you so much, Mona, for letting me examine you today. May I know your concern, please?
Yes, doctor. My concern is about this high blood pressure. What's going
Mhm.
wrong with me?
Okay, so I really appreciate your concern, and I know that could be something very worrying for you. There is a few things that I'm thinking about that could lead to high blood pressure. So one of them is called Conn's disease, which is basically there is overgrowth on one of the glands called adrenal gland, which is just above your kidney, secreting a specific protein, and this is leading to high blood pressure. So that is why what I would like to do, I would like to do further investigation for you and scanning for your tummy, and then we will take it from there. I would also advise you not to use the liquors that you have been taking because this will also increase your risk of having high blood pressure as well. Is that okay with you?
Sure. Can I
Okay.
continue driving?
Yeah, that's a good question, and I'm about to talk to you about that. So, because now you have got some problem with your vision, and we don't really know what's happening for you now, I would really advise you to stop driving for now until we figure out what is exactly causing your symptoms.
Okay, doctor. Thank you. Fair enough. Thank you.
Okay. Is there is anything else you would like to know?
No, doctor. Thank you.
Okay, thank you for your time. So, Mrs.
Okay,
Mona.
you still have 1.5 minutes, but after doing the examination, the real exam, I
Mm,
think it's over. Yes.
mm.
Now you have 5 minutes to discuss with the examiner. Present your positive finding, please.
Okay, this is Mrs. Mona. She is 36 years old female. She has been referred with uncontrolled high blood pressure over the last couple of months. Although she has been on different medication, losartan, amlodipine, and thiazide, her blood pressure is still not controlled. And she checked her blood pressure at home, and it is also found to be uncontrolled. She also complains of muscle weakness, but there was no any muscle pain. And she has also have like headache with blurred vision as well, and she's using Lycros for the last couple of months. She has got positive family history of high blood pressure and diabetes. She's also a smoker. I advise her to stop smoking, and she's willing to do so. On examination, she has got a high blood pressure of 160 over 100. There was no any focal neurological deficit, and the cranial nerve examination was normal. I examined her abdomen. There was no any like bruit on listening to the renal artery, and there was no any polycystic kidney disease. So to complete my assessment, I would like to do a bedside ECG and urine dipstick.
Okay, fair enough. So what's your provisional diagnosis and differential diagnosis?
Okay, so in view of high blood pressure, and also she has got hypokalemia and muscle weakness, my first the differential diagnosis is Conn's disease. Other possibility, it could be because of Lycos use. I would also want to rule out possibility of renal artery stenosis. Third possibility, it could be Liddle syndrome. However, there was no any like family history of like inherited condition runs in the family.
Okay, okay. What other um, differentials you want to exclude in such a lady?
I would also want to exclude any possibility of polycystic kidney disease, pheochromocytoma, and Cushing disease. However, in the history, there was no any like symptoms in keeping with this differential diagnosis.
Okay, fair enough. Okay, so how would you like to investigate?
Okay, so I would like to do first of all full blood count, looking for any anemia of chronic illness or polycythemia. I would also want to do UNE and LFT, especially UNE to make sure there was no any like nephropathy because of the long-standing diabetes. I would also want to do CRB and ESR, thyroid function test, hemoglobin A1C, and lipid profile. And also, I would like to do ECG and echocardiogram, abdominal ultrasound, and also CT for adrenal gland,
Okay, why you,
along with
yes, why you will do the abdominal ultrasound?
abdominal ultrasound just to check whether there is any evidence of polycystic kidney disease.
Yes, anything else?
I would like also to do aldosterone and renin ratio.
Yes, yes, okay, fair enough. Anything else in the
Mm,
ultrasound, in the abdominal ultrasound, other than
I would
checking polycystic
I would
kidney?
like I would like to check for any evidence of renal artery stenosis.
Yes, by doing?
CT with contrast,
Yes, CT
or no,
angiography,
Doppler ultrasound.
Doppler ultrasound first, followed by CT angiography or MRI
Yes.
angiography. Yes,
Mm-hmm.
yes. Apart from the yes, the renin aldosterone ratio, anything else? Checking for
Mm.
maybe the electrolytes. Hmm?
Uh, when I do a UNE, it will include the sodium and potassium. And from
Yes.
what I can see from her GB records, she has got low potassium and high, the sodium is on the low in the higher side.
Okay. Okay. So, what do you think if you like have ABG for this lady? What's your expectation?
I think it will be metabolic alkalosis.
Yes. Yes. Fair enough. What about the urinary potassium?
Mm, I'm not sure.
Okay. Okay. So, you mentioned about Cushing and pheochromocytoma. How would you like to exclude?
So for pheochromocytoma, I would like to send 24 hours urinary catecholamines and metformins. For Cushing syndrome, I would like to send urinary cortisone, 24 hours urinary cortisone and low dexamethasone test, and also ACTH, because that will help me to differentiate between ACTH dependent and non-ACTH dependent. Following that, I would like to do high dose dexamethasone test, and depending on that, I will go on for scans.
Okay. So, what about the treatment? What's your
So,
next step?
so the treatment is a specific treatment and supportive treatment. So a specific treatment will be depending on the underlying cause. So if it is found to be like the cause of her high blood pressure is Crohn's disease, I will give the patient spironolactone. I would also advise the patient to stop using Lycros, because that will also increase her blood pressure. I would also keep the patient under regular follow-up and give her some lifestyle modification like stopping smoking and dietary advice. And also, I will treat any complication associated with high blood pressure.
Okay. And if it is adenoma, maybe something like adenoma, how do you proceed?
So adenoma, I would refer the patient for MDT to be discussed in the MDT, but normally the treatment will be whether it's like a surgical resection or radiation, depending on the comorbidities of the patient.
Okay. Thank you, Dr. Ala. Your time's
Thank you.
up. Thank you.
Okay.
Very
Thank
excellent.
you.
Excellent, Dr. Ala. This is very famous case, and that is very important. You did it very well. A case of uncontrolled blood pressure. Actually,
Mhm,
in the definition of the resistant hypertension, it is a hypertension on 3 antihypertensive medication,
mhm,
and with hypokalemia, either like spontaneous hypokalemia or induced. This
mhm,
the main differential diagnosis here. First of all, you know about the approach of the hypertension. You categorized it first to exclude the essential hypertension, and the non-compliance, the lifestyle modification, maybe the dietary problem, the salt problem. Then you
mhm,
very good excluded the white coat hypertension. You asked about measuring at home the fear or anxiety during
mhm,
measurement. After that, you started to exclude the expected complication of the hypertension. Very important to exclude
mhm,
in history of stroke, especially if there is an history of stroke. This will give high incidence of polycystic kidney disease. Many
mhm,
basis case present the polycystic without like a kidney problem, but rather with a stroke. Okay,
mhm,
so this is a clue for you for that. You need also
mhm,
to exclude the blurring of vision. Very good. Exclude the renal involvement and any anemias as a complication of hypertensive emergencies. After
mhm,
that, you divide the hypertension into hypertension with weight gain, hypertension without weight gain. Hypertension with
mhm,
weight gain, you exclude the acromegaly, Cushing, hypothyroidism, and the obstructive sleep apnea and metabolic syndrome. With
mhm,
this, the four causes of weight gain. With
mhm,
no weight gain, you need to exclude the renal cause, renal artery stenosis, other polycystic kidney disease, the collagen disorders, systemic sclerosis, polyarthritis nodosa, lupus, endocrine related like Crohn's, with hypokalemia and hypernatremia, and was your case. You need to also
mhm,
to exclude the Cushing, pheochromocytoma, and licorice. Okay, other than this, other drugs like steroid, non-steroidal cyclosporin need to be excluded, and the history of pregnancy for the preeclampsia. As
Mm.
regard the hyperaldosteronism.
Mm.
Hyperaldosteronism is after that divided into primary hyperaldosteronism, which is adenoma, or bilateral adrenal hyperplasia. You differentiate between both by adrenal venous sampling, if it is like secreted from one side or both sides.
Mm.
Other hyperaldosteronism is secondary hyperaldosteronism, secondary to renal artery stenosis, renin secreting tumors, or malignant hypertension. Other
Mm.
causes need to be excluded: the Liddle syndrome with family history. Liddle is autosomal dominant. The Cushing,
Mm.
the congenital adrenal hyperplasia, the
Mm.
polycystic kidney disease, and pheochromocytoma. Excellent. As
Mm.
regards your lab, your investigation were excellent. Mainly the investigation is, please start by the diagnostics. Don't waste your time. So
Mm.
from the start, after only you can mention like a basic investigation, full blood count to exclude polycythemia if it's a case of polycystic kidney disease, followed
Mm.
by electrolyte ABG for metabolic alkalosis. Urinary potassium excretion will be increased because there is like retention of sodium, so potassium is excreted. Okay.
Mm.
After
It will
that,
be high, you mean?
yes.
Okay.
Yes, and then you need to order the plasma renin activity and the renin aldosterone ratio, okay, and other investigation to exclude other causes like Cushing, pheochromocytoma, renal artery stenosis, polycystic kidney disease, renal artery stenosis by Doppler, CT angiography, MRI angiography. After
Mm.
that, I tell him I need to exclude other complication of malignant hypertension or
Mm.
long-standing hypertension, detailed
Mm.
endoscopy for exclusion of papilledema, CT
Mm.
brain to exclude any maybe aneurysmal dilatation, anything as regard the complication of the hypertension on the
Mm.
brain, ECG
Mm.
and echo. Okay.
Mm.
As regard
Mm.
the treatment will be spironolactone or amyloride, or this will be mainly your medication or
Mm.
surgery. Okay, you did it very well actually. As regards, if I will mark you as regard the consultation, physical examination, satisfactory. You did it all. You started by excluding the coarctation of aorta, very good. By
Mm.
measuring the blood pressure bilaterally, you excluded the complication of the malignant hypertension, very good. You did the cranial nerve, the eye examination. Then you did
Mm.
to exclude the pulmonary edema, base of the lung, the cardiac examination, and you didn't forget to the abdominal examination and the bedside. The abdominal examination mainly to exclude the stria, the mass, and the renal artery stenosis. Very good.
Mm. Mm.
As regard
Okay.
identifying physical signs, satisfactory. Clinical communication, satisfactory. Differential diagnosis, satisfactory. Clinical judge, satisfactory. Concern, satisfactory. Welfare, satisfactory. The only thing you missed was the driving, and she asked about it. So very good. Thank you,
Okay.
Dr. Alea.
Perfect. Thank you, Sarah.